15.
David, welcome back to 5 by 15. You've done some through this pandemic. Is it right to say this is now in the past tense?
Oh, no, don't ask me. No, I'm a statistician. I'm not going to tell you what's going to happen in the future. Not my job.
So over to you.
Yeah, no, but that was actually an example, that question from Rosie. Very reasonable question to ask, but also very reasonable for me to refuse to answer it. In that, one thing I'm going to just introduce in this talk, I think, is the need for professionals when commenting on something like COVID to keep within their area of expertise. And mine, I suppose, are numbers, but not just numbers, actual statistics, things that have happened, things that are being measured. We'll come on to other sorts of numbers a bit later. So why I'm talking to you, of course, is I'm plugging a book, and I wish I was there, with an audience in front and a drink in my hand, etc. But and where this arose from is that Anthony Masters and I were working with the Royal Statistical Society doing some FAQs about COVID, and then I started one column for the Observer, 350 words, and then we both wrote a column every week for a year, 50 columns. 350 words on COVID statistics. And this was a real challenge, but actually I think I don't think we repeated ourselves. Extraordinary amount of material. There's so many numbers of so many kinds. And so we wrote a book. Penguin very nicely published that for us. And so I'm going to talk about some of the stuff in that book. And then I should have a bit of time just to I'll have to make up some questions because we haven't got any questions. So I'm going to share my screen first of all. I hope this works. Hope you can see that. So that's the book, COVID by Numbers, Making Sense of the Pandemic with Data. Now, the philosophy behind it is that we are just trying to explain things. We're trying to inform and not persuade, because as I have already hinted at, I do feel that many of the commentators, scientific commentators on COVID, have actually got quite a strong opinion about what should be done. And whichever sort of wing of the COVID belief system people hold, they want to push it. And we've been trying not to do that. So I'd just like to illustrate some data, which I hope just helps people understand what's going on. So, okay, let's have some numbers. This is something which is extraordinary as well. Why did Britain suffer so badly? Well, back in late February and early March, the genomic analysis has showed there were more than 1,000 separate outbreaks. Other countries had real pockets of France and Italy, real concentrated pockets where the virus was. In UK, it just erupted everywhere, not from China, but from people having been on holiday to France, Italy, and Spain, and then bringing it back. Except perhaps some of this wasn't just people coming back from holiday, because remember the Madrid-Liverpool match was on March the 11th. And if you look at the distribution of cases brought in from Spain, there is a kind of bit of a spike around March the 11th. So we were in a very difficult situation right from the very beginning. And also because we didn't know any of this. We had no idea what was going on, operating in a complete blind way until April 2020, where I have to say, I'm very proud of this, that the Office for National Statistics started their proper survey, which has become the envy of the world. But of course, I'm hopelessly biased because I am chair of the advisory board for the COVID infection survey. So I would say that, wouldn't I? Okay. I'm picking, lots of stats in the book. I'm just picking bits and pieces. This is collateral effects of the pandemic response is that there's been no flu. This is just from winter 2020 to 2021. Been no flu in the winter we just had, or the winter we're still in. There's no flu either. It's quite extraordinary and unbelievable, lack of flu. And it's because it's not so extraordinary. It happened in every other country as well, that the measures we take that are to prevent COVID spreading are easily enough to stop flu spreading because it's so much less infectious. Now, there is this issue that what many people have mentioned is that means 2 years without any flu in this country. The lack of that would mean a real reduction in a flu immunity. Who knows what's going to happen next winter? It may be very different from what COVID may not be the problem next winter. Okay, excess deaths. This plot, we've reconstructed this, but essentially it comes from the Office for National Statistics every Tuesday morning. I could give a whole talk just on the patterns in this data, because we can see in the first wave, big excess deaths, over the black line is what we'd normally expect. But there's excess non-COVID deaths, the blue ones. These were COVID deaths. These were in care homes, people who didn't end up having COVID on the death certificate, but in fact were dying from COVID. Completely different picture in the second wave. You see there's a big deficit of non-COVID deaths, far fewer than we would expect. The blue line is below the black line, what I'm saying there. And why is this? Well, no flu. That has saved possibly 10,000 lives or so over last winter, and also this issue of what's called mortality displacement, or also the unfortunate name, official name is in Wikipedia, called harvesting, where people's deaths are brought forward, usually because of cold or warm weather, but in this case, because of the first wave of the pandemic, that will have brought deaths forward. And notice after each of these spikes, there's a deficit of deaths following from the people whose deaths have been brought forward a few months. However, that is not the norm. The average length of time life lost from a COVID death is about 10 years. So it is not that most people would have died soon anyway. That is a complete myth. Now, deaths are substantially below what we'd expect, and that if we look at deaths from all respiratory diseases now, from COVID and all the others put together, there are fewer deaths with an underlying cause of one of these respiratory diseases now than there were in 2015, 2017, 2018. So people who are vulnerable to respiratory diseases are safer now than they were before the pandemic, in those bad flu years. So that's an interesting issue, and it sort of goes against the continuing fear that many people are feeling. And of course, many people are vulnerable. The vulnerability varies enormously from person to person. Many people are vulnerable, but to be honest, they were vulnerable before, sadly. Okay, so let's look at some other, the other excess deaths issue, which is very important, is where people have died. This is, I think, a story that hasn't received enough attention, even though some of us have been plugging this since the very start of the pandemic. If you look in the top left-hand corner of those graphs, that looks at excess deaths at home. You notice it's been going along at about 1,000 a week right through the pandemic, regardless of waves, regardless of whether there's any virus around. These are not COVID deaths. These are just people who normally would not die at home, who are dying at home. Now, it really looks like these are not additional deaths. These are people who would otherwise have died elsewhere. And so what we're seeing is a shift to people dying at home, substantial, about a third extra dying at home now compared to what it was before. Now, people are reluctant to go to hospital, quite reasonably. But the crucial question there, like all statistics, only generates more questions. What's the quality of these deaths? And I hope this is something that will receive considerably more attention in the future. Okay, people claim, oh, well, COVID is not that big compared with other disasters or other years that we've had in terms of overall mortality. Well, no, actually, the graph on the left just shows all deaths, just counting the number of bodies recorded in England and Wales. And 2020 was the highest since 1918. Now, there's been lots of other changes over that time. Remember, in the Second World Wars, fatalities abroad are not counted in wartime. So that it's high in absolute numbers, but of course the population's changed. We've got older and so on. If we look at, on the right-hand side, if you look at the crude mortality rate, so that's per 100,000 people to allow for the change in population, you can see that's been steadily dropping since 1900, but then put on a big spike in 2020. But actually, it was only equivalent to the mortality rate, perhaps at the end of the late 1990s. If we then allow for the change in the population, the population getting older, we realize age standardized mortality rates. Look what's happened since the Second World War. It's staggering. They've halved, essentially. That is absolutely extraordinary what's happened. And then the spike comes up in 2020. In fact, it's only, in a way, put us back to 2000, what we were living through in 2003. But that doesn't mean it doesn't matter, because these are still lives lost that shouldn't have been given the current state of the health of the nation. So I'm going to finish there. I've got a couple of minutes left, I think. Yeah, a couple of minutes left. Now I would be asking for questions from the audience, but I'm not going to get any, so I'm going to have to make them up. So thank you very much, Mr. Person at the back, for saying, well, what's it been like being a statistician over the pandemic and being asked, going on the Today program and being asked by people like Justin Webb to explain all the numbers, or worse, being asked by people like Nick Robinson to say, well, what's going to happen? Or like Rosie was asking. And as I said at the beginning, one of the big issues that I had to learn in doing a lot of media work was to try to keep your gob shut when it's not your area of expertise. I used to think you had to answer questions when on the Today program. No, just refuse. No, I'm not going to answer that. It's not my job. I don't do it. So media, I love the media. I think they've done very well on the whole over this pandemic. I think they have done very well, and I've been very happy to work with media. Data journalism has been fantastic, I think, on the whole. But they do have a tendency to focus on blame and speculation. What went wrong? Whose fault was it? And what's going to happen? And so, well, nope, not going to answer. Not going to do it. It's somebody else's job. And it also, I'm not even a modeler. I don't do all those models, predicting how many cases there'll be in the future. I think they've got a really difficult job. Not actually, I think far too much has been expected of them. We only expect to predict the weather or a week ahead. To expect these models to work, I think is to be accurate, I think is expecting rather too much. So I've managed to steer that course, and I must say the media have been very good. Rosie, can I go a couple of minutes, or would you want me to shut up?
No, I never want you to shut up. You can absolutely have a couple more minutes.
Okay, I'll have my
response to that that challenge.
Okay, the 15 minutes of fame. Okay, so next question. Thank you very much, madam, for asking me about dealing with misinformation, because there's so many numbers being thrown around, and some of these come from official sources, and then there are claims being made on social media and on YouTube in particular, which is an appalling source of misinformation. Doesn't mean, at least Facebook makes some sort of effort to scrutinize what's on there, but YouTube really seems to be a dreadful source. And people making claims on the basis of statistics. There are websites full of statistics, full of claims of people about the harms from vaccines, the fact that COVID isn't so important. There was always this thing about a case-demic that went on for some time until it was so obviously untrue, and so on. So all these stories all the time coming out. Don't talk about ivermectin and all these claimed cures that are around there, all based on pretty well shabby statistics. People, and there's a huge attraction for these among people I know. Educated friends of mine say, "Oh, have you seen this video? Have you seen this paper?" And it's some awful paper that somebody's done, claiming to show the exact effect of face masks and lockdowns, which you just can't. You don't know. You can't say what was the effect of these lockdowns. It's just not possible to answer that question from the available data. And yet people claim to great accuracy to be able to say what those answers are. And it's very difficult to deal with that, I have to say. What it's led me is to realize is that the crucial issue is trust and identifying trustworthy sources. And I'd love to come back sometime to 5 by 15 to give an entire 15 minutes on who can we trust.